Well, yes, I understand that as far as remdesivir is concerned, the pharmaceutical company that produced it has agreed to work with several generic producing companies in Asia and India, for example, to start to produce generic versions of the medicine and make it available. I'm not sure about what price it's going to be at, but I'm certain the discussions will go on then about how to make it affordable for countries. I think that is a major breakthrough. And, it's something that happened with the HIV medicines after a certain point. So it's good that it's happened with this medicine relatively early after it was discovered that it has this positive effect. And as far as dexamethasone is concerned, well, normally dexamethasone is available in the national systems in countries. I believe it is produced in a few African countries. I mean, what needs to happen though is hopefully some level of global solidarity and countries who have the means not going out and mopping up and buying up the supplies. So I think that really then is a matter of how we manage the procurement process and find an equitable way of ensuring that all countries that need it have access to this. It might also entail ramping up of production, presumably, if it starts to be very much in demand. As far as the vaccine is concerned, yes, WHO working with some of the other partners, CEPI, Gavi, some governments of some countries, and some of the private sector pharmaceutical companies have had a discussion. As you know, there was a launch of the Access to COVID-19 Tools Accelerator a couple of weeks ago by the WHO Director General with some heads of state, and some pharmaceutical companies and associations were involved in that discussion. I think those principles have been established, the principles have been discussed, and I think what needs to happen now is to see the emerging agreement of the pharmaceutical companies on that principle, including around the intellectual property issue for this vaccine, because it'll be the game changer in this pandemic, and it's really important that those agreements be reached. I think it's a work in progress. The discussions are ongoing.
Right. Thanks for that. You mentioned earlier we had that discussion about priorities within countries across the African continent. I wondered also whether the pandemic is going to be a wake-up call across the world in terms of support for the World Health Organization. There have been some massive changes in the structure and the participation, particularly of the private sector in the World Health Organization over the last three decades or so. And I know there's a debate about the value and importance of that. Do you think that hopefully coming out of this pandemic, or at least moving towards the next phase of it, there is going to be a move to strengthen the World Health Organization, not just with money, but obviously that's going to be an important part, but also strengthen its reach and somehow boost the international solidarity and relationships that are so important in coordinating a response to a global pandemic?
Yes, I mean, I certainly hope so. That there is a discussion going on, and as you possibly know, there is an agreement to evaluate the response to this pandemic and the actions, in my view, not only of WHO but also of other entities, the member states, and also very much the private sector, whose importance has been brought into relief by the contribution that they've had to make in the response, not least the fact that they produce and have had to, at an unprecedented scale, consider increasing the production and working very much with multilateral entities to ensure procurement. So, and the role of WHO, in the debate that has been going on about whether WHO did well, whether WHO did not, I observed that many member states and academic institutions and some of the private partners involved in global health have emphasized the important role that WHO does and can play. And so I'm certain that a great deal of discussion is going to take place now as soon as there is the opportunity to reflect on what happened, to see what is the scope of what WHO can do, and what are some of the limitations of WHO's authority to ensure that entities follow certain rules, if you like. And this has been highlighted. Those who have analyzed the international health regulations and the relationship between WHO and member states have also identified the limitations of WHO's authority as an advisory body, as a secretariat of member states, where at the end of the day, it is the member states can decide whether to follow some of these sometimes voluntary rules. And it's those matters that need to be considered if really, as a collective, as a multilateral collective, the world decides that we all need to abide by certain rules. If we put in place an organization that is going to be the custodian of these rules, it needs to have some level of space and authority to take action and to make sure that we mutually, if you like, support each other. And I think that really speaks very much then to the global solidarity, to linking our interests as countries with the interests of the rest of the countries in the world and agreeing to certain principles that will enable us to look after each other, even as we look after ourselves and our own populations and countries. I mean, that's very much what I hope will happen. I've heard indications that some countries are thinking about things this way, and I hope it means that there will be clarity. I mean, if there is not actual strengthening, at least there will be clarity of the responsibility of WHO. But I think that WHO has the potential and scope, if supported by the member states in terms of defining some of these rules, of really helping in terms of controlling diseases. The way of working has changed a lot. You know, it changed in relation to the Ebola outbreak, say in the DRC, and it's changed yet again. There have been massive adjustments and innovations in the way of acting in responding to this pandemic, which I hope will be taken into the future.
Thanks. Of course, during the Ebola pandemic, there was a resolution at the Security Council declaring the Ebola epidemic a state of security emergency, and it was passed by the UN Security Council, and it seemed to give the UN system a lot more power within its response, and certainly forced the establishment of a committee, I believe, to coordinate responses between the various UN agencies. That wasn't done this time for what appears to be political reasons. But that aside, I mean, do you think that sort of resolution at the Security Council level would improve the coordination and the global response this time? I mean, the Ebola pandemic with the epidemic with the current COVID-19 pandemic.
I mean, I certainly think a discussion or even a resolution on and agreeing on some ground rules on some key issues could help to align some of the distortions around the response. And, you know, as I was saying earlier, one of the biggest challenges in having a pandemic in which virtually all countries in the world are involved, that's a very unusual situation, has been the, how can I call it, the distortion in the global market then. So all the countries needed the same items at the same time. And countries are very unequal in their ability to procure in terms of volume, in terms of availability of money. And we've seen an absolute distortion of the global market. We've seen countries with the ability to produce if you like, often limiting and prohibiting the exportation of items that were very seriously needed by other countries that don't have the capacity, countries with the ability to buy large volumes, secure their supplies in such a way that countries that are not, even with support from the multilateral agencies, from ourselves, from the African Union, have simply not been able to have access to these facilities. And then secondly, those principles of exchanging information with each other, enabling neighbors to work together, are also, these are political decisions that have to be made. And then I think, though, that having secured those kinds of agreements, we need to be very clear about then the operational side of things and ensure that we enable WHO to play its role, which has been recently, if you like, revamped and somewhat revised after the Ebola outbreak, the way of working, and which we think has improved significantly WHO's responsiveness, speed of getting on the ground, mobilizing and getting operations in place. So I think if we have a combination of those political discussions that enable agreement on some key principles and rules of the game, and then operations in line with what we think WHO is capable of delivering, working very much within the UN with our sister agencies in a way that we've done in this COVID pandemic, defining the, if you like, the key role that each and every one of us can play, and then working within the scope of the UN reform. We are having very frequent discussions now as a coordinated UN system at the regional level, at the global level, and also at the country level. So I think things have moved on since the Ebola outbreak, and the UN is working much more coherently together, each one to his comparative advantage, and then together working with other partners.
Thanks so much for your time, Dr. Moeti. It's been really interesting conversation, and I know our audience wanted to hear from you words of both information and some sort of assurance that the response is ramping up and hopefully going to limit the effect of this pandemic on the continent and beyond.
I'll just end by saying we have to continue to be alert. We have to absolutely continue the hard work of scaling up the capacities, being ready and adjusting. I think the most important thing this country are being confronted with now is, okay, having taken those strong measures, now feeling compelled to open up, we hope, expect, and will be advising them to be flexible, to be responsive to what the data tells you. You've opened up, you get a spike, you might need to close down again for a bit, do so.
And that's all for this week. Thanks again to Dr. Matshidiso Moeti for breaking off from your busy schedule to talk to us, and we wish you every success in your endeavours. The continent depends on it. You can always catch our previous podcasts on theafricareport.com, where you will find a formidable archive of programmes with many of the key newsmakers in Africa. Do rate and review this podcast on whatever platform you use to listen to these programmes. And so, for the Africa Report this week, this is Patrick Smith signing off and hoping we will all be in touch again very soon.